Okay. Hi, everyone. My name is Michelle Tam, and I'm the Partner Marketing Manager at ISA Cybersecurity. Thank you for joining us today for the Fireside Chat to learn more on how University Health Network solved device visibility and control. Before we begin the discussion, I'd like to share a few quick housekeeping notes. First, this webinar is being recorded, and the recording will be made available after and sent to you via email. Second, there will be time for a Q&A at the end. Please put your questions in the Q&A button feature at the bottom of your tabs and note which panelist the question is for. We'll do our best to get to everybody's questions, but if we do run out of time, we'll send a follow-up email with answers to the questions we didn't get to. And lastly, as you can see, there is a chat function. We encourage you to interact with other guests there, but please ensure that you only put your questions for the panelists in the Q&A feature. Awesome. So I now have the pleasure of introducing our moderator, Greg Jackman. Greg joined Forescout in February 2019 as the country manager for Canada. He has more than 25 years of experience in all facets of IT and cybersecurity, and has consulted across financial, healthcare, and utility sectors on data center infrastructure and IT security. Pass it over to you, Greg.
Awesome. Thanks so much, Michelle. I really appreciate that quick introduction. Listen, before we get started, I would like to go ahead and introduce the panel. Could you even, Kash, would you mind just doing a quick introduction of yourself?
Yeah, sure. So good morning, everyone. My name is Kashif Parvaiz. I am currently the Chief Information Security Officer, CISO, at the University Health Network, which is the, for those who don't know, it's the largest teaching and research hospital in Canada. You know, I've been in cybersecurity for many years, and prior to this, I was in the education sector at Ryerson and at formerly eHealth Ontario before then. And so I've got a sort of a long history in healthcare. And then prior to that, I was even in the energy sector. So so I bring a lot of that experience and a lot of the same, so I can speak to a lot of the challenges that many of us are having with device visibility and control. So that's it.
Awesome. And Jonathan, do you want to take 2 minutes or a minute and just introduce yourself?
Yeah, thanks, Greg. So my name is Jonathan Jesse. I am a systems engineer, security engineer with Forescout. I've been with Forescout for a little bit over 5 years now. I've been working with UHN since February of 2020. So almost will be 2 years soon. Prior to joining Forescout 5 years ago, I spent 10 years doing endpoint management consulting and pre-sales around that. So cover all kinds of customers. Excited to be here and excited to hold this chat. Thanks, Greg.
Awesome. Perfect. Jonathan, obviously, thank you very much. And Kash, a huge thank you for taking the opportunity to do this. We really appreciate it and look forward to hearing kind of your experience and your journey as you embarked on this challenge. So Kash, a huge thank you for doing this in the partnership between our two or our three organizations. So really appreciate it. I want to just kick things off. Instead of just getting right into the content, I thought it'd be a good idea just to run a quick poll, if that would work. So Michelle, if you wouldn't mind posting, I'll read out the question. What we really kind of want to ask is, do you feel confident that your organization has full asset inventory and security control of your IT, IoT, and OT devices across your entire environment today? So if you wouldn't mind just taking a minute, we'd like to hear kind of your input on where you think you stand, if you feel confident about specifically your organization's asset management or control and of IoT and OT devices. So Michelle, we're going to wait for those responses, correct?
That's correct. We'll give about 10 more seconds or so for the responses to come through. We have about half of the participants have submitted thus far.
Okay, great. Awesome.
And I'll definitely share the results so everybody can see it. So let's give a few more seconds. Okay, and I'll go ahead and end the poll now.
Excellent.
Can you see the results?
Yeah, absolutely. So with respect to the answers, thank you everybody for sharing. So this is not untypical of organizations right now. 88% of you, which is very similar, feel that they don't have full control of their asset inventory, especially with respect to IoT and OT devices. Not only the asset side of it, but control. A Forrester survey also just referenced in 2020, I was reading up, they took a poll of roughly 403 companies across healthcare, financial, and manufacturing. Roughly 69% of those organizations said that they have far more IoT and unmanaged devices versus managed devices. And within that same poll, they said that 26% of those organizations, predominantly in healthcare, have roughly a 3-to-1, where it's unmanaged 3 to every 1 managed device. So we've heard about this for a long, long time, but the trend continues to grow on the unmanaged side of everybody's organization, specifically in healthcare, and how we manage that. So I think it's fairly common, and where you are at, or most of you people, how you feel is common across most organizations. So thank you for sharing. We greatly appreciate it. I'm now going to ask our first question for the panelists, for both JJ and Kash. Guys, can you demystify OT versus IoT and outline some of the unique security challenges for healthcare organizations that you've experienced or seen? I'll start with you, Kash, if you want to take on that question.
Yeah, for sure. So this is a great question. So, you know, IoT, with the explosion of the internet and with wireless and 5G technologies everywhere, you know, across the world, IoT has taken off. You know, I think most of us have internet-enabled doorbells. They've got now. I'm looking for. I'm in the market for a range right now. Like my wife wants to change to a gas range, and a lot of them now come with built-in technology. You can preheat the oven and that sort of thing before coming down and actually touching it. So a lot of these devices now are connected to the internet, and really that's what it is. That's really IoT is in a nutshell. It's taking devices that were normally, I guess, dumb, for lack of a better word, and not connected, and actually getting them up so you can do have a bit more control over them. Via the internet and via some sort of an application. Coming from energy prior to healthcare, I was up to my eyeballs in OT as well. So the OT side of things is, while it's maybe a subset of IoT, the application is very different. So you've got a lot of systems that manage sort of processes and controls, and actually are set to either alert or take action on various triggers that happen, right? Like coming from the pipeline sector before this, we had lots of OT, and when the pressure got to a certain point in a line, it would sort of step it down or release some of it and that sort of thing. So like you had a lot of these process control systems, and in healthcare as well. Taking it to the healthcare context, we have a lot of OT as well. We've got pushing monitors, we've got blood analyzers, we've got a lot of these imaging machines that are running key processes in the healthcare side of things. And so one of the challenges that I'm seeing is these things are just being procured by to make clinicians' lives a lot easier.
Sure.
The numbers of OT devices are being procured at an exponential rate, really. Like, I mean, they've got budget to buy a lot of these things because the clinicians are asking for it. Being a teaching and research hospital, we're sort of on the cutting edge as well. So there's new devices being brought in all the time, sometimes without IT involvement, many times without IT involvement. So definitely that is one of the challenges here, is that, like, how are you going to manage these? How are you going to even identify that they're there? Some of them are so brand new that they may not even have sort of a footprint or a signature of them to see what the device is. So this is what I'm seeing from a healthcare perspective. I'll pass it over to Jonathan maybe to comment.
Awesome. Thank you, Kash. And Jonathan, anything else you want to add to that or augment?
Well, I think Kash nailed it. When we look at our customers at Forescout and other friends and coworkers in the healthcare space that I talk about, it's a lot of devices that they've never really thought about that are on the network. I have a retail store that had, when they think IoT, a grocery store, they think about the deli slicer, right? Because the deli slicer tracks how much meat that they cut each day. When we look at healthcare, Kash summed it up, right? We have all of these devices that are on our network. We might not know about it. They all probably get patched differently as well. I think I mentioned in my opening that I did endpoint management consulting, and I learned how to patch everything, right? Whether that was SCCM or some other tool. When we talk about healthcare IoT, vulnerabilities and patching is handled a whole lot differently. We may not be able to take a system offline and do the downtime to put a patch in place. And that was something that I had to change my thinking around. I was used to patching laptops, and now I have to patch devices that have operational risk along with security risk associated with. They have downtime. They affect the business in different ways than a laptop or a desktop might.
Well said. It's interesting, Jonathan. There's an article actually this morning on CNN on some of the research that we were doing. We've been involved in at Forescout. We're going to attach the link at the end of this seminar. We'll have a wrap email, and it's actually just within the Forescout labs. We have a specific lab that is constantly testing endpoints and checking around vulnerabilities. And there's an exposure of specific OT and healthcare vulnerabilities with respect to an operating system. Siemens called Nucleus. It's Nucleus 13. There are 13 different vulnerabilities, kind of spanning across what we saw about 400 unique devices that we kind of brought to the market to let people know there are all these vulnerabilities. It's pretty focused on OT and healthcare IoT. So we're going to send you that link. It's a great article, or a very interesting article that CNN posted today with the research being done by Forescout. So kind of a really timely, it just got published this morning. So we'll include that at the end, but thank you both, Kash and JJ, greatly appreciate it. I'm gonna move to question 2, if that's okay. And this is specific to Kash. As you embarked on this journey, what was the security challenge you were trying to solve? And I think also equally as important was, how were you able to drive the business case and develop and get executive sponsor for that business case to fund something like this?
Yeah, so I guess our security challenge, as I mentioned in the first question, was really similar to, I guess, the poll question that was put at the very beginning there. I was in the 88%, I suppose, category at that time. And so, yes, I mean, having a large network, especially the size of UHN, with multiple campuses, it's very difficult to get a good, accurate inventory count. We're located, in the downtown core, but there's like 3, 4, 5, 6 buildings, all of which have multiple floors and a lot of equipment. So, getting a good inventory can be challenging, even in a single building. So that was one of the things, and then the other is, of course, the environment itself. Every day you look out and you see more and more organizations getting breached, having ransomware attacks. We saw TTC a couple of weeks ago. We saw out east in Newfoundland just last week, their whole province was down due to this. So, and so you really need to know, I guess, what you have out there before you can think about, putting in mitigations and protections. So, that's definitely the security challenge for now. The other is also with when COVID hit and that sort of thing, we had a minor ransomware as well, like one or two devices that were out there, and so it was challenging just to locate them and find them, and with COVID, actually to deploy someone physically to go get the machine. So, I think the business case was really almost spoke for itself there, is that you needed a remote capability to not only identify, but also to be able to control and contain the machine as well. So that's really how the business case was developed, is that it was a capability thing, that we don't have the capability not only to see exactly what we have directly connected at any given time, and we didn't have the means to contain something should it go sideways, that sort of thing. So in an acceptable amount of time. So that was a simple capability business case that was put forward.
Awesome. And so you made a decision, you went out to the market, you were solving a problem, you chose Forescout. We are grateful for that, obviously, in our partnership. Can you share a few of the results, some of the challenges, and then some of the key success factors to the project that you began to embark with our organizations?
Yeah, for sure. So, I mean, with any public sector procurement, as some of my colleagues maybe who are in the participants will know, you need to do your due diligence, and you need to run these procurements and look at various technologies that can do the same thing. So that was done. And one of the things that we found, I guess, specifically with the Forescout product, was that it had a really good rate of inventory. So it was good at getting a lot of the various devices that are out there and categorizing them properly. So that was one that really made things a lot simpler for us once it was in play. And the other was just the reporting of it as well, and I'll share some of them after. But the reporting of it from an executive perspective as well. So yes, there's going to be detailed reporting for the people who are hands on the keyboard and our SOC and that sort of thing. And a lot of it also had to do with integration as well with our current security stack. So as you know, Forescout is a great tool, but it's not going to be the be all and end all. There's going to be other tools in your environment, and so it has to play well with the rest of what you have with your monitoring tools and et cetera, and your SOC tools. So that was and it seemed to be the best fit for us in that situation. One of the challenges I guess I found was that the visibility and everything is great. I think one of the things that we did find, and we had some help with our friends from ISA, is that the tool itself is great. We didn't have some of the prerequisites, and so one of the prerequisites is, of course, is to be able to have that network sort of net flow information that's coming through, and something that can feed those things, right? So, we have a legacy infrastructure, so it's our own issue. We had a legacy network, didn't have 802.1x running. It didn't have a lot of span ports as well that were available. So we did have to go out and procure a sort of an aggregator type solution. We ended up going with Gigamon, just as an aside, but that was sort of a prerequisite. But once that got going, and it was fairly simple to set up, then we were able to get a lot of good information. And maybe we can switch to the next screen. You can see, I guess, some of the devices that we were able to get to, and a nice simple breakdown from me as when I report up to the executives and to the board. Things like views like this make it very simple, so they're not inundated with too much information. There is definitely a lot of information available below if you drill down, but half of this has to do with reporting to my peers, as well as in the digital operations space, as well as to the vice presidents and above. So, this gives you a little breakdown. This is straight from Forescout, by the way. It's a dashboard directly from Forescout. And a good breakdown, if you look on the right there, a whole bunch of healthcare stuff. And this is at the highest level. Of course, you can drill through and you can see actually what those devices are. I didn't want to go into too many details, but you can do that through the solution. And so this gives you sort of a view of what is possible. And for the most part, 90% of it was sort of out of the box. I'm not going to say there was a little bit of tinkering that had to be done for a small subset of what it found, because it was miscategorized. So there was a little bit of hands-on manual towards the end, but but it wasn't a lot. So this is kind of what you end up with your asset breakdown, and it's real time too. So as assets go off the network, then the numbers will change as well. So that was one of the things that we also found. We do have asset inventory through our other IT service management systems, the systems that you make requests for IT services for. We use ServiceNow, and it wasn't that it was an overlapping technology. We found it to be a complement because the ServiceNow system, it just does a scan and it keeps things forever. Like it doesn't. It's not a real-time point-in-time thing. So as things go off the network, it still keeps them in the inventory. So we've actually worked with our ITSM folks to get it. We're working with them to try to get a direct communication. Right now, it's manual, just to give them the latest inventory, just because their numbers always inflate, because if it comes on and goes off, it still stays there. So I find this to be a little more accurate than the ServiceNow database. So that's a long-winded answer, but I wanted to sort of answer all the questions.
No, it was perfect. Really, it was great. And I just have one subsequent question. You're predominantly a heterogeneous network infrastructure, but majorly focused in Cisco, and I think with a little bit of legacy Brocade in the data center.
We have Brocade.
On that?
Yes. So we have some Brocade. It is a very, very old network, and so this is one of the things that was really helpful. So, I'm thinking most of the people on this call will have a more up-to-date network than we did, because ours is a very legacy network. We're actually in the midst of just starting a what they call a network refresh, and they're going to be spending millions to redo the network. And once they redo that, we'll have more information available. We'll have 802.1x capability. We'll have all those cool features. Right now, we're still doing what we can do with the legacies that we have.
Awesome, thank you. And JJ, is there anything else that you want to add there with respect to? I know you're intimately involved in the journey at UHN. I just want to make sure that if there's anything from your perspective, I know you're getting into the weeds sometimes with them.
I'll try to stay high level then, Greg.
Okay, no.
I think what Cash mentioned is that oftentimes, an asset system may not see a device as it comes online or offline all the time. And keeping that asset management system up is key, and making sure, right, that we know exactly what devices are online or offline, especially as we come back to work. Maybe my work device has been, at my home for 18 months or however long. We need to make sure that we keep all of our records up to date, all of our information about that particular device up to date. So asset management, understanding, when that device comes online, when that device comes offline, is great. And then, we did spend some time on some of those, different devices, maybe that we've never seen before, as Cash mentioned, right? UHN being leading edge, and a research teaching hospital system. There may be something that needs some manual classification work, but we were able to really nail down every device that is within their network.
Awesome. Thank you, JJ. And from there, moving to a state of control, right? And determining when we move to based on policy sets, on determining a control, allowing on and off. Okay.
Yep.
Okay. Good. Any comments on that you want to suggest? Either to you, sorry, I don't want to get too far in the weeds. I apologize, but if you want to talk anything on the control side, JJ or Cash.
Well, I mean, really, it comes down to that our device or that device is UHN's device, and understanding that device is UHN's, right? That and what's the process behind it to make sure that it is. Cash mentioned earlier, that oftentimes IT doesn't know that they've added a new system to their network, or security might not know. And so the process to make sure that that device is added securely, we discover it, we put the right controls around it. All of that is going to take involvement of maybe people other outside of IT security as well.
Awesome. Thank you.
And one of the things that I wanted to say also is that we only have about you see this count there, 42,000 and change. devices. We only have about 15 to 16,000 actual staff at the hospital, of which we have, most of them have managed computers, right? Windows computers. So, there's probably going to be like 1/3, maybe 30 or 35% of those Windows machines there represent the managed computers, and that's fine because for the most part, managed computers are not the ones I really worried about because they already come with their standard EDR solution and that kind of stuff. Those are the ones. They're okay. It's the other ones that are unmanaged, the ones that you have to really pay attention to. And it's interesting if you look at the right side, the IoT. Yes, for the most part in a hospital, you would know that most of them are healthcare IoT, but there's a bunch of building automation and other things that are and office stuff that also you have to take into account. In a hospital, you are also running a building as well as all these other things too. So we have a lot of, and in a hospital especially, we have a lot of backup generators and that sort of thing because you need to prepare for those kinds of things as well. Just because you have people's lives on the line, so you can't have power disruptions, that sort of thing. So building automation is something that is almost as important as the health ones in a hospital setting. You need to ensure that you've got AC, cooling. We have a lot of, I don't know how many healthcare people are on here, but we have freezers, like medical freezers, which go down to like minus 60, minus 70 degrees Celsius for biospecimens and that sort of thing. And those things, you'd lose all that bio data if it didn't have these backup generators and that sort of thing. So it's not your regular Samsung fridge or freezer, So that's what I'm saying, that there's a lot of other things that are outside of health IoT, but they're still just as important.
So I'd like to go back real quick to what he said about those non-managed Windows devices, right? One of the things that we found is that, oftentimes maybe the device driving that CAT scan or that MRI machine is really a Windows machine in the background. And, prior to this, I never really thought about, what type of technology is driving that CAT scan, that, patient monitoring system, right? And understanding that Windows machine is connected to a large medical device, an expensive medical device, a life-saving medical device, and that there needs to be the various processes in place to gather that data, classify that data, understand the difference between my laptop versus the CAT scan device, the imaging device, those types of things. And so that's one thing that I have learned over time working with UHN as a customer.
Thank you. To both of you, thank you. I'm going to turn to question 4, and I feel like you couldn't run a cybersecurity seminar without asking, right? What is zero trust? It's such a hot topic in cyber today. So how do you see this solution fit in your overall cybersecurity active defense strategy, and that relative to what you see at zero trust? So I'm gonna start with you, Kash, on that, if you wouldn't mind, kind of how you see zero trust and how this solution around active defense fits into your vision of zero trust.
Yeah, so I know every seminar you go to, everyone's talking about zero trust and that sort of thing. And while the concept itself is great, where you authenticate not just the user but the asset and then the device, all of that is great. The challenge that I have, and I think maybe the folks in healthcare can relate, is that the clinicians, especially in situations where you're taking care of patients and it's as well as life-saving situations, they really need access to that data at their fingertips. And so really any sort of delay could result in sort of a catastrophe. So, you have to be careful with zero trust. I know that in principle, it is great. We just need to just be careful with zero trust. So what we're thinking, where we're at, we're sort of going to do maybe a, not zero, but maybe like, there's some areas where that need to be fully trusted, especially on the clinical side, when you're into diagnostic imaging and you're into these sort of things, those ones, can't have barriers to connecting, because those are ones that the ER uses, the emergency rooms, all, that sort of thing. So while I do agree, though, there's a lot of issues with remote users. We have a lot of vendors, and because all these medical devices are unique and need special care to be maintained. So we have a lot of vendors coming in as well. So in those situations, yes, zero trust definitely makes sense. For those sorts of situations where, and even clients who come in with their own machines and that sort of thing, that part is totally good. So what I'm trying to say is that while the model of zero trust is fine, I don't think it's 100% doable in a healthcare setting. So that's what I'm going to put out there. I mean, I'd love to hear what other people have to say, maybe in the chat or that sort of thing. But it's it's a lofty thing to get to in healthcare. That's what I'm going to say.
Thank you. It's interesting you say that. We in conversations with another very large healthcare organization, that was one of their questions is, even if I embark upon a zero trust strategy within the four walls that I have, how do I trust other healthcare providers that we provide data to as they come in? If they haven't embraced zero trust, then the model falls down a little bit. So it's a pretty hard strategy to architecture to solve across the entire estate, I think is another way to put it.
Yeah, like what we're thinking,
because you have trusted relationships with other organizations, and if they don't embark on the same technology and the same policies, then how does zero trust work? Sorry, Cash, go ahead.
Yeah, no, what we were thinking is maybe like, so we'll do part way with maybe various security zones and that sort of thing where zero trust is applied, but on the sort of the clinical services zone, maybe that area, because we are trying to do, and that's one of the things that we actually are trying to do is, we inherited a network that was fairly sort of flat for the most part, and so we're trying to make those zones, set up, and with some of Forescout's help as well. Actually, they've been able to help with some of that design to get sort of a spanned, I gotta call it medical device or clinical device networks and that sort of thing around. So those can be more trusted, but they're very controlled, and then maybe you have zero trust for the rest. Some sort of a hybrid is what I'm trying to say.
Awesome. JJ, anything else to add on that or anything you want to share that?
I don't know. I think, Cash summarized my thoughts as well. He's been doing such a great job. I feel like I'm not, you know what I mean? The one recommendation is, when you think zero trust, right, you have all different models of it and all kinds of different documents, right? You have Forrester's Wave, you have Google's Beyond Corp, and then also there's the NIST documentation off of the US. And to me, I think the easiest one for me to understand when I talk about zero trust is the NIST publication around zero trust. I would recommend reading that. It's a very short document. It's very easy to read. But that would be my recommendation as you move down the journey. The other thing is it's a journey, right? There's not going to be, tomorrow we're not going to decide to be zero trust and it works. Also, not going to be one vendor that's going to solve all of it as well. That's what I was going to say. If I am buying zero trust marketing, every vendor out there says that they're the single vendor that can solve all of the issues. You're going to have to work with your vendors as partners, get together a team, trusted advisors that can help you understand the various methodologies. And then, what's best for you, right? As Cash mentioned, their vision of zero trust will be different than the grocery stores or the enterprise that is in one office. So you've got to understand what your vision as an organization is, and then have a trusted vendor that's going to help you out, and a trusted partner, and it's going to be more than just one solution.
Perfect, well said. And as you mentioned, everybody has a heterogeneous environment. You have a network infrastructure, you have firewalls, you have, and all of those are points in which you need to make action or something happen based on a decision. So you need that interoperability, and it's not one company doing it all, but an interoperability with many companies or interoperating in order to invoke a zero trust strategy or architect a zero trust strategy where it fits. And I think Kashif said that perfectly.
Yeah, no, I was
weighing risk reward on
That's
where
right.
to want to deploy.
So someone just explained it to me before, and I thought it was a great way to explain it. It's like, the old audit days where it's trust but verify. So like, zero trust is the opposite of that. It's verify then trust, right? So that's what they're doing. You're verifying who it is, what they're accessing, et cetera, all that sort of thing, and then trusting them. And that's great for the most part, but yeah, you're right. In those super, clinical settings, you need to have them. It always has to be set up, so you have to do it the other way around. But that is a simple way to think about it. Trust but verify, or verify but trust.
Perfect. Well said. Very well said. Thank you. Question number 5, and as we've kind of looked and gone through this journey together, our 3 organizations, what's next for UHN with it comes to cybersecurity? And what is the next phase for your organization?
Yeah, so I think that there's a few things still that obviously need to be. So we have a fairly detailed roadmap for Forescout, and so the next steps include some sort of automation as well. Right now, I think I think she flashed the screen before. If you can just go back to that screen that we had, there's a screenshot that I had there.
Oh,
so,
yeah. Right.
So this is one of the. So this whole discussion is about visibility and control. So the control part of it is, here's a sample of. So on the bottom we have the Forescout screen. On the top we have our SIM, which is we use Splunk here. And really what we've done is able to really move from an automated sort of a manual method where we had actually people, trying to track things down, where now the detection comes in through the Forescout at the bottom. You see an instance of malware there, but immediately, and it also shows in our SIM at the top, and you're able to just go in and click, like our SOC analysts are able to quarantine the device. You see on the bottom right there, quarantine the device from Forescout. When you do that, it'll go into, I guess you see here, some of our quarantine VLANs that we have already set up with the help of our network teams. And so you can immediately sort of quarantine things and sort of be done with it. And really, if as anyone knows, when you are responding to any sort of incident that's out there, timely containment is your number one best defense. So you need to quickly identify and able to remotely control quarantine. Once you do that, yes, okay, you can do all of your forensics afterwards and that sort of thing that you want to do, of how to get in, whatever. But at least the immediate risk to the organization and the service disruption is minimized by doing so. So this is a huge benefit. This capability that's shown here is a huge benefit, and really that's actually what helps the business. So like, small disruptions don't turn into huge disruptions and cause code grays, et cetera, which you don't want from a cybersecurity perspective. So this is a huge capability, and so what we're trying to do, if you go back to the question you were asking, was right now it is a little bit manual, just because our 24/7 SOC analysts sort of verify first before they actually do the blocking. But I mean, I know Forescout has the ability to do it in real time itself, like automated. So we may be looking at some of that, and we also may be looking at some, just like we mentioned, zero trust. So getting our zones, our various VLANs set up correctly across the network, so that devices, as they come in, once they are identified as an end user device, they go into the right VLANs. So dynamic assignment is something that we're also looking at based on what they are. We don't have today the sort of the device checking upon connection to the network. So we do right now do the trust but verify. So but you can do it the other way around with Forescout, and that's one of the suggestions that we may be looking at, especially for managed devices, where it'll actually do a pre-check, I guess. I don't know what the word is, Jonathan knows, but it's a pre-check of the device health, and you know, does it meet all these things? Yes, and then you can connect to the network properly.
Yeah, we've talked a couple of times, right, with the differences between, you know, comply to remain versus comply to connect, and I think that that's what Cash is hinting at, right? That you know, right now through the trust but verify or comply to remain point of view, we validate that those machines meet the correct posture or correct information, and then they log on the network. You know, pre-connect or comply to connect, right? My laptops, my desktops, my devices comply with my policies and then move into trusted. And so we've had various conversations as to what that would look like there.
Awesome. So in summarizing, it's further automation, continuing interoperability with tools like your SIM, and then advancing the platform where comfortable into further state of compliance checking to say before you connect in the right areas to say, I'm comfortable, I want to check allow versus connect and let me verify, but I want to check your compliancy before.
Well, yeah, and then the other big thing that I wasn't clear on it was the setup of these zones for the medical devices. We want to actually have some sort of filtering system set up between them. So where Forescout can help there is that they, you know, you can see what these medical devices talk to on a regular basis, and you can sort of baseline their communications on a data, because really, you know, a diagnostic imaging computer really just talks to a PACS server or some other things, a few, maybe 3 or 4 devices. That's all it really talks to on a regular basis. So once you do that and you identify that, then there's little risk of, we profile it for like a month or 2 or whatever. And then you can actually put together those, you know, firewall controls, that sort of thing, to zone them off properly without impacting their performance, because you kind of know what they talk to on a regular basis. So I think that's another big thing that we'd like to get to in the future.
Awesome. And that's real time, seeing the data, seeing the flows, endpoint to destination, and who's talking. Right?
That's right. And I think it has the ability to do like a what if scenario. So if you were to apply those rules today without actually applying them, you know, you profile it over a month or 2 months, or whatever, and you see, oh, 99% of the time it goes here, but this one time when it communicated over here, you know, is that like required or not required? You know, that's
yeah. Awesome. Okay, listen, last quick question. As we wrap, and once again, this has been incredible insight, so I thank you, is if you were, we have a broad audience here, I think predominantly in healthcare, but what would be one piece of advice you would like to share with them or the team here on the journey that you have gained through your organization? So you've embarked in this journey of device visibility and control within your organization. One thing that you would maybe want to share with your peers or colleagues?
Yeah, like I think my advice, I guess, would be that you know, don't go at it alone as a security only win or capability. I think that's the big thing, is that it's a benefit to everybody. Not only like, so we partnered with our IT service management team, you know, for the asset side of things. We also partnered with our medical engineering folks, because they actually get benefit of it. They sometimes are not involved in some of the procurements because some small research area or some other clinical area will go out and buy it on their own outside of the process. So so like it's news to them, and it's helpful for them too. So yeah, it's like you have a bunch of groups, stakeholders that are on that committee. And so it's not just, oh, well, security wants it and they're going to go out and buy it. It's not, I mean, yes, there's security aspects to it, but there's a lot more benefit to it than just for cybersecurity.
Awesome. JJ, anything else you want to add to that answer? And I'm going to ask you, you can, if I'll ask that question, and then I'm going to ask another right underneath this, was the networking team, and is the networking team involved in this project from your perspective?
From this perspective, yes, the networking team is involved in this project. The other one, as Cash said, was the medical or clinical team. You know, we walked through, like, these are the devices that we're seeing. You know, we think they're this. Forescout thinks they're this. You know, can we validate those? And so I think getting those people involved, both networking and the medical group or clinical group, was really key to this project because, you know, as Cash said, right, they have buy-in. They feel like they're being heard. Instead of, you know, big bad security saying no, we were saying, you know, here's how we can work together. And we were doing, you know, of course, we're doing this over Zoom and remotely or Teams, whatever, right? But to get those people actually all involved in the process, you know, outside of just, you know, security saying no, we were saying we'd like to help. Here's what we believe. Here's the devices that we know about. How can we help you guys do your jobs, but also secure those devices? And I think it was key. It should be key to any implementation or project, is to have multiple groups involved to make sure that they all understand and get buy-in.
Awesome. Thank you. Thank you. Michelle, if I'm not mistaken, I think that's the end of our questions. So if I can I refer to some of the questions that were posted? Are you good with that, Michelle?
Yeah, we can jump straight into the Q&A now.
Okay, awesome. So I'm gonna table this to the panel. The first one, I would say, JJ, we have a question saying, is the discovery phase dynamic in real time?
Yeah, so it is dynamic in real time. It is, you know, knowing what the network knows. So as I mentioned at the beginning, if you were on, you know, I spent 10 plus years as an endpoint management consultant, and I threw an agent on everything and anything. And I knew only what my management platforms told me, right? Like from a device count. Quickly at Forescout, I learned that the network knows the truth. The network never lies. And so knowing in real time what is on the network, right, it can give me that accurate and device count. We always say that we see 30% more devices than what you really know is on your network. And the other thing that I always tell my customers or prospects is, you know, if I ask you how many devices and you give me a nice round number that ends with a 0, you know, I always tell you, you don't actually know. If we go back to, you know, Cash's dashboard, right, he actually knew what it was at 40,000 and something instead of just 40,000, you know, with that big round number. And so real time, I know what's on the network. The network is accurate. The network knows the truth. And we just need to get it in a way that's digestible and easily presented.
Awesome, thank you. And then a follow-up question to that, actually, it's is similar. I'll go to you, Cash. You mentioned you have 2 repositories. You have the Forescout repository, which you've reported there, and then you have the CMDB. With respect to the Forescout, what data are being pulled and retained in inventory from the discovery phase? So are you pulling a lot of information about those endpoints?
Yeah, there's a lot of information. So I think, like, you know, I didn't want to go into too many details in the picture.
Don't have to here.
In the picture was just a device count and that sort of thing that was put up. But when you drill down in the actual thing, yes, you can get, you know, all of the you know, the OS information, all of the you know, various patching levels, etc. All of those things, you know, if you have you know, your SMB1 enabled, all that kind of stuff that you have, I mean, that's all there if you want to drill down further. So yes, like all of that detailed information is all there. But I just wanted, just for clarity, I just left the high level. But yeah, that is definitely, and then one of the things that I think Jonathan was saying as well, which is right, the numbers always fluctuate. So that the picture that was taken is at 42, I've seen it go up as high as 46,000 sometimes, and I've seen it go as low as 38 or so. It all depends on, you know, some people were in the middle of the pandemic, it was down at 37 because there was, like, you know, a lot of people were home, and then it went up for some times. And so yeah, it does fluctuate, and it's definitely real time.
Great, awesome, thank you. I'm going to say, Cash, I think this is more for you, but JJ, we always love hearing your voice as well. Next question is, as Forescout interacts at the network level, where do you draw the line with security administration, configuration, the tool set, and with the networking team getting involved? So at what portion do you say this is a security initiative, or this is where, from a
So yeah, so that's a great question. So Zaid,
Yeah, I thought it was. Yeah.
so Zaid's my buddy. I know him from
Okay.
from Harvard. Hey Zaid, it's good to
Awesome.
have you on the call. Anyway, but yeah, no. So what the way that we've done is basically the network team assists in actually architecting the network for us. So like I mentioned, we had a sort of semi-flat network, and we wanted to set up this concept of quarantine zones and quarantine VLANs across the board, so that if something was compromised, that information was covered, you could put it into that quarantine zone. So we didn't have those quarantine zones, so we worked with the network team to extend those quarantine VLANs across on all of the different facilities that we have, so that they were named the same, they had the same range, etc. So there was some work that they needed to do on the network side to configure it. But then the way that we did it was that security is more of a governance function. So if this is shows up as compromised, then we just leverage what the network team has done for us and set it up for us, that it goes to the named quarantine zone. So basically if it's a network change that is required, and they need to create these zones, the one that we're trying to do for a clinical, to create a clinical subnet and that sort of thing, so that if this device shows up as clinical, it goes into that. The creation of those zones and that sort of is where the network team does, but the actual decision making of is it this or is it that, that is where the security team gets involved. So I think hopefully maybe that makes it easier to delineate.
So really, especially on the policy sets and determining what the policy is against an endpoint is clearly driven by you. Okay, yeah, right. Which makes sense. That absolutely makes sense. And JJ, just to go on that, when we provision to the network, UHN uses a multitude of ways of pulling the data. Is it? Yeah, go ahead. Do you want to talk to that?
Well, I don't want to
get
too technical, right? But yes, there are multiple ways that UHN is getting data, whether it's talking directly to a switch or to a VPN, getting data from a span port, right? There's multiple different ways that we can consume traffic. If we want to go in depth, I'd love to chat.
No, it's okay. Right? I shouldn't ask that question. Let's not get in the weeds. Thank you.
As a technical guy, I could talk for hours about that. So I'd love to chat with you if you have any other questions to anyone on the call.
No, I just wanted to validate that within the networking and as we provision to the network, that UHN is using different methodologies to say in this network side of the network we expand, and this side of the network will speak directly to the switch plugin, and so on and so forth. Totally get it. Thank you.
And I think it's key, right, to have both security and networking involved in a project such as this, right? I don't want to fight against the networking guys. Good, they probably know more from their networking, background and about the guts of the UHN network in this case, or your network, than I do. So I want to get them involved right from the beginning and say, we want to work on this together. We want to succeed together.
Right. Fantastic. Thank you. Last question. For healthcare organizations looking to discover assets on their network and deploy visibility tools, what would you say was the biggest unknown or aha moment maybe you had once you had deployed the technology? Was there any sort of oh, sugar, right? Wow, or was there any aha moment for UHN? I'll ask both of you, anything that you saw that you...
No, I think I guess once the output started happening, that was great, because I knew we
old operating systems, or sorry, I apologize.
We knew we didn't have a good inventory. We knew we had a way more than what we thought we had, and that sort of thing. Some of the things I didn't realize we had that much network infrastructure. It's a good 15 to 20% of our network is all just wireless access points and other network infrastructure, legacy infrastructure. So there is a lot of that in our environment, which is more than I thought there was going to be. I knew there was going to be a lot of other things, but yeah, it's difficult. It's just an eye opener, I guess, and I think it will be an eye opener for anyone who deploys it. And I think Jonathan was saying it right as well, that you only know about whatever, a third or whatever it is that's on your network at any given time. One of the things I will say also is that by design, we have excluded hospital guest networks, right? So that's pretty obvious. I think most hospitals would do that. The guest network is just an internet-only zone for patients and their visitors, et cetera, that sort of thing. So that is completely outside of this. We're only monitoring inside portion of the network, right? So the actual inside corporate zones, clinical zones at UHN. So that's kind of the scope. Just I just want to make sure that that was clear as well.
Awesome. Thank you. How are we doing time-wise? Michelle, I'll defer to you. Are we close to the end of time or?
Yeah, we are. If we want to quickly address the last question that came in,
Sure.
and then we'll wrap it up from there.
Sure. Okay. And I think, JJ?
I was just going to take it. Yeah,
Yeah,
this is a pretty technical one. Comes in.
Can you read it out?
Yeah.
Listen, I know my role, right? I read. I don't give anyone intellectual property here. So just so everybody understands the question, I'll read it off. How is MAC addressing randomizing handled for mobile devices? Will they be seen as the same device? If it goes offline, it comes back online with a new MAC address.
Yeah. Now, Greg, you add more value than just reading the question. Come on, don't sell yourself short. So
thank you.
You're pretty technical compared to some of the other people I've worked with. So don't sell yourself short. This is a pretty technical question. I would love to handle this directly, one-on-one type of thing, as it talks to like the guts and core of Forescout. But you know, as some of us may know, we start looking at like iOS and their latest changes. I know Android is doing the same thing, that when I connect to various wireless hotspots, we do randomize, you know, the MAC address. Forescout has built some things to handle that and to deal with it. Would love to have a chat. So drop me a note afterwards. We can have that in person. You know, to the person who asked it. Yeah.
Awesome. Sounds good. So if you want to follow up with the person asking the question, but you said there's integrated technologies to address it, but it gets pretty technical. Okay, great. Michelle, I'll turn it over to you.
Awesome. Thank you.
Thank you.
That was a great lead through, Jonathan, because if you do have any questions, do connect via this email or your account manager at ISA Cybersecurity. If you don't have an assigned account manager today, or just don't know the contact information, feel free to reach out via this email, and then we'll connect you with the Forescout team. But yeah, thank you so much, Kashif and Jonathan and Greg, for, you know, having this conversation today and being very open, candid. I'm sure your peers have, you know, had some learning opportunities from this. And to close it all up, I just would love to, you know, we'd love to hear feedback from the audience on this webinar, and make sure that, you know, ISA Cybersecurity, along with our partners and our clients, are delivering educational thought leadership content that's useful to you all. So there is a 2-minute survey that will pop up when you leave this webinar, and it will show up in your browser. And if you complete the survey by November 12th, and you enter your contact information, you'll be entered into a draw for the chance to have a $500 donation made in your name to the hospital foundation of your choosing. So if you want to participate, please do fill out the survey. And thank you again, everybody. Please reach out if you have any questions.